This Focus on Health segment is brought to you by Aurora Healthcare.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. Today we're at the Aurora Medical Center in Oshkosh. We're going to be sitting down with Dr. Jody Solinsky. Now she's an electrophysiologist and we're going to be talking about some of the devices and procedures used if you have an abnormal heart rhythm. All right, we've made our way to the cath lab. We're with Dr. Solinsky. Good to see you again. Tell us a little bit about the cath lab. This has been recently updated.
Yes, we always try and get the newest equipment, the most updated fluoroscopy machines, which we use to sort of as an x-ray to guide us as we're doing either catheterization procedures for our cardiologist plumber colleagues or our electrophysiologist procedures where we put in devices.
Okay, and that's what we want to talk a little bit about today, especially some of the devices and the procedures. So let's talk a little bit about pacemakers. I think that's something a lot of people understand. They've heard what a pacemaker is, but what it actually looks like and how it's used.
Sure. So this is an example of a contemporary pacemaker. Reason somebody might get this is that their heart rate is a little bit too slow. So essentially a pacemaker is going to speed it up. This is what we call the pulse generator. So basically it's the battery plus the computers that run it, and then it's connected in the heart to a wire, a lead, basically an insulated lead that sits in the heart and then connects up to the pulse generator itself.
Okay, and where would that be placed in our body then?
So the pulse generator tends to sit right here under the collarbone, up here in the shoulder, under the skin. Depending on a person's size, usually you don't see it at all, just a little scar. Sometimes if you're a little thinner, it might stick out a little bit of a bulge there.
Okay, and again, when is the pacemaker used?
Pacemaker's used when someone has a slow heartbeat.
Oh, okay.
Okay, because essentially if someone's heart's beating too slow and they feel lightheaded or fatigued, or even if they were to pass out because of a slow heart rate, that might be a time when we would put in a pacemaker.
Okay, and before we have the pacemaker put in, what would be some of the symptoms? Would we start to feel kind of sluggish?
Everyone can feel things differently. Often fatigue or sluggish or trouble doing activities. So sometimes people say, oh, I feel fine just sitting here, but when I get up to walk up a flight of stairs or when I'm doing my normal everyday routine, it's just a little bit harder. I maybe get even a little shorter breath or just fatigue, legs feeling tired.
Okay, what are some of the other devices we have to work with?
So some of the other things that we have are defibrillators. So these are for the opposite of a pacemaker. This is when someone's heart is beating too fast in a dangerous rhythm from the bottom chamber of the heart. Essentially, some people have a weak heart muscle, and that heart muscle can contract abnormally, and that can make them predisposed to a dangerous fast heart rhythm that if left untreated, because the heart's not really beating, it's kind of just quivering. So the blood's not really moving, blood's not getting to the brain, and if not enough blood gets to the brain, a person could pass out or could even die.
What would the symptoms be for somebody dealing with that ailment?
Often we put them in as prevention before someone has an event, but if someone were to have an event, it could be, sudden lightheadedness, palpitations, heart racing incredibly fast, and oftentimes the initial presentation, if we're not catching it ahead of time, can be someone having a cardiac arrest.
How important have these devices been to not only saving but prolonging life and quality of life?
Oh, it's been remarkable. If you go back to prior times when we had heart attacks, someone just had their heart attack and maybe they made it out of the hospital, and now people are living through their heart attack, but then years down the line their heart muscle gets weak and they're at risk of these arrhythmias. With these devices, we're essentially about 10 to 15% of the time someone that would have had an event, we're saving their life. And it's because it's such a big deal, it's basically death. That's why we put them in prophylactically.
Right, and these devices have been around for a while. Technology is also improving and making devices smaller and giving you a little more different freedom.
Exactly. So in comparison to the traditional pacemaker, which is put in through a vein in the heart and sits up in the collarbone, now there's newer pacemakers that are kind of basically the size of a bullet.
Looks like a fish hook.
Or a fish hook that gets put in through the vein in the leg. So there's no, as with everything else in today's modern technology, we're going wireless. So this is sort of a wireless or a leadless pacemaker.
Are the procedures long, painful, or what can a patient expect if you have to have one of these procedures?
In average for a traditional pacemaker or defibrillator procedure, it's about 1 to 2 hours to have it put in. Usually on the shorter side of that. They tend to be done under local anesthesia, so there's just numbing medicine and then a little bit of sedation to make you sort of calm and relax and hopefully sleep through most of the procedure. So minor discomfort, kind of like a pulled muscle after the procedure.
So it sounds like an outpatient procedure?
It is. You spend one night in the hospital after they're put in order to help monitor and make sure that there's everything's going well in the morning, and then go home the next day.
All right, I know you're a fitness buff. Give us some tips on how we can avoid, possibly, if the genetics don't come in, what are some of the things we can do to avoid having these devices put in us?
It's tough because sometimes there's nothing that you can do because the wires in our heart are just like the wires in our house. Every once in a while they just fail. So the electrical system of the heart is one thing that you can't always exercise to prevent. But not that you shouldn't exercise, and we put them in that people do, but that you can continue living your life. But sometimes, unfortunately, there's not a ton that we can do from a prevention standpoint to prevent electrical problems with the heart.
And I would imagine, like anything else, getting any issues figured out, any problems diagnosed early, so regular
Definitely.
checkups?
Regular checkups, and any sort of symptoms, make sure you mention them to your primary care doctor, because there are things that we can do, such as wearing monitors, that can help decipher if it may be an electrical problem of your heart that we can treat and fix and get you feeling better.
All right. Great tips as always. Thank you again for joining us.
Thank you.
Certainly a lot of great tips from Dr. Zielinski. Again, make sure you get your annual exam. If you have any questions, check with your primary care provider. You can also give us a call here at Aurora in Oshkosh. Phone number always 303-8700. I'm Ted Stefaniak. We'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.